IBS affects millions of people worldwide, but not people understand exactly what it is, and even fewer people understand how to treat it, including actual doctors. There is so much misinformation out there. Well, in today's video, I'm going to literally cut through the BS to tell you exactly what you need to know about IBS and how a few simple changes can get your IBS better controlled. We'll discuss what exactly is IBS. We'll discuss the causes of IBS. We'll discover some of the triggers. And at the very end of the video, I'll give you my tips as a GI expert on how to manage your IBS. Guys, let's talk about poop. Howdy, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm a board certified gastrologist trained at the Mayo Clinic. You can see us up at Gastro for all your GI needs. And don't forget to like and subscribe. First of all, what is IBS? IBS stands for Irritable Bowel Syndrome. It's a very common condition affecting 1 out of every 5 individuals. In fact, in my clinic, almost half of my patients have a diagnosis of IBS. Now, it's assumed that IBS is just a catch-all for all sorts of conditions, which we don't know exactly what's going on. But let me tell you the truth. IBS is a real condition. Now, the way we diagnose IBS is basically with a clinical exam. Yes, me actually talking to my patient can give me the diagnosis of IBS in 95% of my patients. So all my IBS patients, you have to have some sort of pain, whether it's bloating with pain, discomfort with pain, or actual pain. That is a cardinal symptom of IBS. And with that, you have to have a change in your bowel habits or your bowel caliber, how often you use the restroom, or the size and the shape of your stooling. And typically that pain will be affected. It will get better when you have a bowel movement. So pooping will make the pain better or have some relief of that pain. There are 4 main types of IBS and ways that we can classify what type of IBS that you have. There's IBS-D, which D stands for diarrhea. So mainly you have a lot of diarrhea with your IBS. There are IBS-C, the other spectrum, in which you have mainly constipation. You just can't use the restroom, you have pain associated with that. You have IBS-M, which is a mixed pattern. You fluctuate between diarrhea and constipation. It could be in the same week, the same day, or even in the same hour, and a lot of our patients fluctuate between that. Then you have IBS-U, which is unclassified IBS, which we really can't classify you neatly in one of these criteria. Now, besides these main symptoms, there's a cluster of other associated symptoms with IBS, including bloating, distension, heartburn, nausea, reflux, farting, burping. And you can also have issues outside the GI tract, including difficulty urinating, painful intercourse, low sex drive, even fibromyalgia, which is commonly associated with my IBS patients. Now, the important thing to realize is that you have to have that core symptom, which is abdominal pain, meaning technically the medical term, if you don't have pain, you don't have IBS. So for example, if I have a patient come to see me who has straight up diarrhea, just watery stools, but there's no pain, they don't have IBS. So it's very important that you have that cardinal symptom, which is abdominal pain. So what exactly causes IBS? This is a very common question I get from my patients, and the truth of the matter is we don't know. We know it may be multifactorial, or it could be a combination of different factors. We know that one cause is called the brain-gut connection. What goes on here can manifest inside your GI tract, and same thing vice versa. So for a lot of my patients who have a lot of stress, anxiety, depression, that can manifest in IBS type symptoms with abdominal pain, diarrhea, constipation, or even a mixed pattern. We also know that there's what's called visceral hypersensitivity. It's a very fancy term, but it's fibromyalgia of your gut. The nerves are hypersensitive inside your GI tract. It's like having the radio turned on, but the volume is way up there. And this is actually a true reason why people have IBS. So what I feel as maybe some pain and constipation, since I don't have IBS, it's not a big deal. But the exact same symptom is manifested tenfold in my IBS patients because of the visceral hypersensitivity. We know the gut microbiome does play a role. About 20% of our patients who have IBS have a change in the gut microbiome, and focusing on that with diet and medications can get their IBS symptoms better. Food does play a complete role when it comes to IBS. A lot of my patients think they can cure their IBS with foods, and it may not be the case, but we do know that food does play a role when it comes to triggering IBS symptoms. We also know that childhood stress can affect IBS. If you've had issues in your childhood, whether it's some sort of trauma, whether it's physical, mental, or sexual, that can also cause a lot of my patients to have a lot of their issues manifest later on in terms of IBS. And this is why a holistic approach including stress management, is part of the package when it comes to treating my IBS patients. Now keep in mind, there's not one size fits all, and for a lot of my patients, it may be a combination of multiple different factors that can cause their IBS symptoms to occur. Now what exactly can trigger IBS? And not everyone has the same symptoms occurring every single day. There are some triggers that we know can make IBS worse. One trigger certainly is stress. When you are stressed, if you have a lot of homework, if you have a lot of stress in your life, if you can't deal with stress in an effective manner, this 100% will make your IBS symptoms worse. We know that dietary factors can make IBS symptoms worse. This is why sometimes managing those dietary triggers can improve your IBS symptoms. That's why it's important to note, if you have symptoms, what did you eat the day before that could have triggered those symptoms? So how do I, as a GI doctor, manage my patients with IBS? So number one, I tell my patients, this is what you have. So many of my patients are confused by their body. They don't know why they're having bloating and pain. They don't know why they're having change in their bowels. I want to do an investigation to find out why and tell you this is exactly what's going on. So it may involve doing different blood testing, maybe some imaging, or maybe even taking a look with the scope. This gives me the capability to give the exact answer for what is going on. Number two, it is a chronic disorder. Means that you're going to have symptoms for the rest of your life. And I hate to tell you this, but this is very, very true. And anyone who tells you otherwise, that they can cure your IBS, is frankly lying to you. We currently do not have a cure for IBS. I'm hoping in the future we will, but it is a chronic disorder. It doesn't mean it needs to control your life chronically, but it is a chronic disease you have to be aware of. And with that comes the expectations. There may be ebbs and flows in your symptoms, but that's okay because we can hopefully manage those ebbs and flows to get you feeling better. However, even though it's a chronic disorder, it will not kill you, nor will it lead to cancer. Now, it certainly is annoying. There's no denying that, but it's not going to shorten your life. It's not going to progress to something worse. And we can manage your symptoms with either medications or dietary options. So let's go into that. What are the dietary recommendations I recommend for my patients? But first off, I tell all my patients to eliminate dairy. You may not realize this, but dairy is a very common trigger when it comes to IBS issues. So things like cheese, ice cream, milk, you need to avoid this to hopefully minimize your IBS symptoms. Number two, eliminate artificial sweeteners. You have a sensitive gut, and having those artificial sweeteners make it more difficult for you to digest. So things like Splenda, get rid of it. Sweet and low, eliminate that from your diet. And also see the foods and the things you're eating may also already have artificial sweeteners in them, so avoid that to get you feeling better. Remove processed foods. Don't eat these. These are not good for your gut, and if you already have a sensitive gut, it's going to make things worse. Eliminate greasy foods. You know that grease that can make it taste so good, those chicken fingers, so yummy. Get rid of them. They are not good for your gut. They're terrible for your gut microbiome, and they can make your IBS symptoms worse. Coffee. So coffee can be a trigger for a lot of my IBS patients, especially if you have diarrhea. So if you have diarrhea or you're more prone to loose stools, try to minimize coffee. Now, if you have constipation, maybe consider adding coffee to help you go and help you flow. Gluten. Now, gluten seems to be the big bugaboo when it comes to GI issues. So there are patients who have IBS that have a gluten sensitivity. So see what your triggers are. Try to eliminate gluten, see how you feel. But don't just eliminate gluten wholeheartedly if you don't notice a benefit with that. Gluten itself is not bad for you. And anyone who tells you that, frankly, has no idea what they're talking about. And then a low FODMAP diet. Out of all the diets that are out there, especially when it comes to diarrhea, a low FODMAP diet has the best evidence for this. I have a lot of videos on this. It says the best evidence to control your diarrhea. Now, the things that you stress about a low FODMAP diet is that it's very hard and it's very restrictive. So always make sure you speak to a dietitian to see exactly what tips and tricks you can do to hopefully get your diet taken care of if you're going to do this. I never recommend for my patients to do this alone or on the internet or do any other way. Get a dietitian's help to make sure you do it correctly and to make sure you don't maintain on such a strict diet long term. Now keep in mind, IBS is not strictly a dietary disease. So if you don't feel better, even after changing your diet, don't be discouraged. That's okay. There are some individuals that need more stress management, more holistic approach, maybe even medical therapy. Next is that we need to make some other lifestyle changes as well. Besides diet, you need to find ways to manage your stress. So things like exercise, going for a walk, meditation, prayer, yoga, these things have been shown in clinical trials to help out. And if that doesn't work, sometimes using medical therapy to help out with stress is perfectly fine. Don't worry about that. That's not a stigma. And it's a very common way to kill two birds with one stone, managing your stress, but also those effects can help out with your gut as well. And then lastly, in terms of lifestyle, do not underestimate exercise. It is so beneficial for you. It's good for your brain, it's good for your gut, it's good for your heart, and guess what? It's free. Yes, it's free. This is one of the most effective options you can do to help out with your IBS. Now, I'm not just one that tells you eliminate everything. I want you to add things in your diet. Here are the foods that I recommend to incorporate in your diet to help out with your IBS. Number one is fish. Fish is fantastic, especially grilled fish or baked fish. As good omega-3 fatty acids, has a lot of antioxidants to help out with your gut microbiome to improve your gut if you have IBS issues. Number two are cooked vegetables. Now be careful, some of these vegetables are in the high FODMAP range, things like broccoli and cabbage, so be careful of that. But other vegetables that you want to enjoy, incorporate that into your diet. It has natural fibers, natural prebiotics, and probiotics to get your gut microbiome taken care of. Whole grains. Whole grains are fantastic for your gut. Things like sourdough bread are really good to help out with your gut microbiome. It gives you fibers, antioxidants, vitamins, and minerals to help out with your GI tract. Low-fat yogurt is excellent. It has prebiotics and probiotics in them. Just look at the content, make sure there's not a lot of sugars in there. Also make sure there's not artificial sugars in that yogurt. Now keep in mind, if you're lactose intolerant, be careful of the yogurt recommendation because you may be making things worse for you. And then turmeric. Turmeric has been shown to help out with inflammation of your gut. Consider adding this to your diet. Have some foods with turmeric in it. Add it to your coffee. You may enjoy the taste, and it'll help out with inflammation as well. Ideally, you want to use the powder form over the pill because it has better absorption. But if you can't do that, certainly try a pill instead. Now, I know that IBS can be a very confusing topic. Hope this video gave you a good rundown of what a GI expert recommends when it comes to helping out with your IBS. If you have any questions, consider leaving a comment down below and come see us at Gastro for all your GI needs. So thank you for watching. Don't forget to smash that like button. And if you haven't already, don't forget to subscribe to my channel and newsletter where you can get great tips and tricks like you're learning in today's video. Thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.